Okay, well, hello everyone and good evening. Welcome and thanks for joining us. Again, I'm Tracy Austin, Director of Alumni and Community Relations at Colby-Sawyer. We're thrilled to have a nice group of alumni, parents, and friends online with us this evening. I'm pleased to be joined by Kevin Finn, Dean of the Colby-Sawyer School of Nursing and Health Sciences, who will be sharing the latest news from the school and its programs, as well as discussing the college's enhanced partnership with Dartmouth-Hitchcock Health. Before I turn things over to Dean Finn, I'd like to review the format for today's Zoom presentation. We are recording this presentation and we'll be sharing links to the webinar within the next week. The microphones and video feeds for all of you in the audience have been disabled for the presentation. If you are having difficulty seeing or hearing us, please send us a message in the text chat. Dean Finn will plan to make a presentation and immediately following, we'll have a question and answer period. You may type your questions into the chat box or by using the question and answer function. Several of you have submitted questions when you RSVP'd for this event, and we have those on hand. We'll track additional questions as they come in this evening, and we'll do our best to get to as many of those as possible. Just as a reminder, the chat and question and answer functions can be found at the bottom of your Zoom screen. Simply move your cursor or touch your mobile device and those icons should appear at the bottom of the screen. So that's it for our intro. And with that, we're ready to begin our session. And I'm pleased to hand over the screen to Dean Kevin Finn.
Thank you, Tracy. Welcome, folks. It's great to be here. And as Tracy said, I'm going to walk you through a presentation tonight, highlighting some of the key things that are happening in the School of Nursing and Health Sciences here at Colby-Sawyer, and the exciting partnership with Dartmouth-Hitchcock Health and all the opportunities that have going on with our students and this with this partnership. So let's jump in, and then I'd love to open it up to questions at the end, and love to gain some conversation and answer some questions from the audience and the community. So kind of here's what I'm going to walk through tonight around the presentation is talk a little bit about my background and I think kind of how I've come to Colby-Sawyer and where kind of my background and skills kind of meet the needs and where Colby-Sawyer in the School of Nursing and Health Sciences is going in the future. We're going to talk a lot about the pivot to nursing and health sciences at the college, with the focus particularly on how our program has expanded, as well as some enrollment updates, so you get a feel for how through the partnership and the expansion of programs, how that's translated into student enrollment. We'll walk through a little bit about the Dartmouth-Hitchcock Health partnership and what that means and what that has afforded us here at Colby-Sawyer and at Dartmouth-Hitchcock to do. And then kind of to wrap up, we'll talk a little bit about kind of future opportunities and where we see the college and the School of Nursing and Health Sciences moving in the future. So I'm really excited to be here and kind of talk you through some of these exciting endeavors that we've been engaging in at Colby-Sawyer and the School of Nursing and Health Sciences. So to kind of kick it off, I wanted to get an opportunity to share a little about my background, just so that the audience can understand kind of where I've come from and how I kind of have landed here at Colby-Sawyer. So a little bit about my educational background. I have a bachelor's in sports medicine from Merrimack College. After being there, I went on to Fairfield University to get my master's in curriculum and instruction. So my background is in clinical athletic training. At Fairfield, I was an athletic trainer working with the student athletes at Fairfield while completing my master's in curriculum and instruction. From there, I went on to Boston University to get my doctorate in education and curriculum and teaching. And then most recently, I was at Harvard University where I received a certificate in higher education leadership, which is, I think, a big part of the reason that I kind of joined here at Colby-Sawyer, and I'll talk a little about that in a little bit. So that's sort of my educational background. And in my professional experience, as I said, I studied sports medicine at Merrimack College, and I became a certified athletic trainer. And so for most of you, you will probably know what an athletic trainer is, but it's a healthcare profession where you often are treating and preventing injuries with a physically active population. So out of undergrad, I took a position at Fairfield as an athletic trainer, and I work with their sports medicine department there and work with student athletes at Fairfield. After graduating from Fairfield, I came back up to Merrimack College, which is in Andover, Mass, and became a lecturer and athletic trainer at Merrimack. And in that role, I started to kind of get my first experience teaching. So it was kind of a dual appointment where I had the opportunity not only to teach, but also practice athletic training. And it really sparked my interest in education and in academia. And so after that point, that's when I decided to go back to school and earn my doctorate in education. And really from there, that's where I had an opportunity to take a faculty position at Merrimack in the Department of Health Sciences as an assistant professor. And my career sort of shifted from clinical practice to more of an academic appointment with teaching and research. At Merrimack, I moved through the ranks of assistant professor, associate professor, and ultimately a full professor. While at Merrimack College, I became the department chair of this in the Department of Health Sciences. And then at the end of my career at Merrimack, my last position was the associate dean of the School of Health Sciences. And so just a little background there at Merrimack's growth. I was a big part of and involved with the expansion of health sciences at Merrimack. When I first started there, we had 4 faculty members and about 150 undergraduate students. And when I left in 2019, we grew our faculty to over 200 and, we grew our faculty to about 22 faculty, and our student body was close to 1,000 students. So was really a big part of developing new programs, growing the college, and I really enjoyed that part of my job and my career. So while at Merrimack, I was also teaching, and in particular, as the picture there on your left side is, I taught, my background was really teaching anatomy and physiology to undergraduate students. And so I got a real experience over my 15 years teaching undergraduates at Merrimack in really understanding the human body and how it worked and functioned. So what you're looking at there is a piece of technology that we bought that's called an anatomage table, which is a 6-foot human cadaver that is obviously virtual, that students can interact with, and they can we described it often as a giant iPad. You could dissect the human body, you could zoom in and zoom out. It was a really neat tool. And so my teaching kind of focused around anatomy and physiology while at Merrimack College. And then I had a strong interest in research. And the right side of your picture there, you can see some kids being physically active. And so I did a lot of work with looking at the effects of physical activity on science education in adolescence. And while at Merrimack, we developed a program called Active Science, which looked at integrating physical activity and movement with science learning. And so did a lot of work with YMCAs throughout the country trying to promote physical activity for our youth, while also using the data that they would generate from running around and to help them learn science. So you're seeing a picture there of some kids playing what they call a sport wall. What you see on their waist, so they're all wearing pedometers. And so as they run around, the pedometer captures their steps, their physical activity, their calories. And then after they ran around, we developed a mobile app where they would take that data and then put it into an application that would bring them through a science lesson around their own physical activity. So I spent the part of my career looking at those factors around physical activity promotion and science education with kids. And so while at Harvard, I was doing this, my certificate in higher education leadership, and President Sue Stubner came down and gave a talk to the audience about Colby-Sawyer. And that's where I first learned about the college and really talked a lot about, Sue talked a lot about the opportunities and the pivot to nursing and health sciences and the Dartmouth-Hitchcock Health Partnership, and they would be looking for a dean. And so I thought it was a great opportunity. It afforded me some ways to do a lot of the things I had done at Merrimack around growing programs, working on clinical partnerships. And so in 2020, in January 2020, I started as the Dean and Director of Clinical Partnerships here at Colby-Sawyer. So This next slide kind of shows you what we've done when we've pivoted to nursing and health sciences here at Colby-Sawyer College and in the School of Nursing and Health Sciences. So, you know, a little bit of timeline. There's been a lot of conversations that happened prior to me getting here around workforce needs, and in particular in New Hampshire and in the region, and how Dartmouth-Hitchcock Health was looking for an academic partner to help grow their workforce. And Colby-Sawyer College and Dartmouth-Hitchcock Health have had a long-standing relationship, particularly around the nursing program. And it seemed like there was a win-win for both organizations. Colby-Sawyer was looking to develop new programs and increase their student body. And Dartmouth-Hitchcock Health was looking for a pathway, a pipeline to increase their workforce. So in 2020, in January, the enhanced partnership with Dartmouth-Hitchcock was solidified. And that's when I arrived, just as that partnership began in February of 2020. And kind of catch you up to speed over the past 10 months since I've been here, we've done a lot of work around implementing the programs that were talked about that the Dartmouth-Hitchcock needed and Colby-Sawyer was looking to develop. And so the development now, since I've been here, we were working to implement them and actually roll those programs out over the past 10 months. So the conversations here in this slide really show you some of the key outcomes or program development factors that went into that partnership. So the first one there you see is really to grow undergraduate nursing by 15 to 20 students every year. And then increase the number of graduates that we graduate at Colby-Sawyer in our nursing program. And so that was a really big, that's a big outcome of our enhanced partnership. The second one was to grow our RN to BS online bachelor to completion program here at Colby-Sawyer. So we have an RN to BS bachelor completion program. So those are folks who have an associate's degree. So they're already nurses, they're practicing, and they want to come back and get their Bachelor of Science in Nursing. So we wanted to grow that program. Additionally, we wanted to add some new tracks to our master's program. So when I arrived, there was a Master of Science in Nursing, an MSN program. It had one track, it was our Clinical Nurse Leader track. Since then, we've developed two new tracks in that program. One is Nursing Management and Executive Leadership, and the other one is Nursing Education. The other program that we rolled out this fall was another bachelor completion program, which was really to help the respiratory therapy field in Dartmouth-Hitchcock, and lots of hospitals and healthcare organizations are really facing a shortage of respiratory therapists. So we developed our respiratory therapy to Bachelor of Science degree completion program here at Colby-Sawyer that we also rolled out this year. We developed an Associate's in Health Science, which is a really unique and exciting program that really partners with Dartmouth-Hitchcock's what they call the Workforce Readiness Institute. So they have an internal education system at Dartmouth-Hitchcock where they train medical assistants, surgical technologists, and pharmacy technicians around how to become medical assistants and surg techs and pharm techs. We work with them to help those students that were in that program complete their associate's degree in health science by taking 5 courses with us here at Colby-Sawyer. So that's been a really attractive program for those students. And then there's been a lot of work across the campus here at Colby-Sawyer to develop new undergraduate programs that are also related to health sciences. So we rolled out a Bachelor of Science in Social Work, a BS in Addiction Studies, a BS in Medical Laboratory Sciences, a BS in Healthcare Administration, and a BS in Health Science. So as you can see, there is a lot of work being done around kind of developing new programs in partnership with Dartmouth-Hitchcock Health and once again, their workforce needs. And so all of that program development has been kind of implemented. And now, like I said, we've been spending the last 10 months or so really working hard to promote the programs and market them and recruit students into them. So fast forward to today, this is what in the School of Nursing and Health Sciences here at Colby-Sawyer, here's the kind of what I'd say the menu of programs are. So like I said, we have an associate in health science, and that's that partnership with the Workforce Readiness Institute at Dartmouth-Hitchcock, where those students who are medical assistants can come pretty quickly after they get certified and continue on to complete their associates in health science. We've got 5 bachelor degree programs. We have our Bachelor of Science in Nursing, which is our flagship undergraduate program. That's a longstanding program at Colby-Sawyer. A Bachelor of Science in Exercise Science, Bachelor of Science in Public Health, and then, like I said in the previous slide, a new program, which is a Bachelor of Science in Health Science, and then this, like we said, a Bachelor of Science where you get your respiratory therapy completion program. And then, like I said, at the graduate level, we've got our Master of Science in Nursing with these 3 tracks. The Clinical Nurse Leader track, which has been around at Colby-Sawyer since about 2016. And then the 2 new tracks, which we just launched this fall, which is Nursing Management, Executive Leadership, and Nursing Education. So once again, I share this slide with you to get a sense of kind of what the breadth of programming is in the School of Nursing and Health Sciences here at Colby-Sawyer. So just to also get a sense of not only our programs, but kind of who we are as personnel. So in the School of Nursing and Health Sciences, we have 15 full-time faculty. We have 2 professional staff members that work with us. One is a new hire, which has been really helpful for our new programs. It's we call it Director of Professional Learning. And that person really is the segue between our professional learners, our folks who are in our master's program, who might be nurses up at Dartmouth-Hitchcock, or getting their RN to BS. This individual works closely with them to evaluate their transcripts, to help them register for classes, to really be the liaison between them as working professionals and in the college here. So that was a really great hire that we made this summer to help with those professional learners. And then we have a whole host of we call part-time faculty. So these are faculty who are oftentimes they have a primary profession. They might be a working nurse leader up at Dartmouth-Hitchcock, and they might teach a course in our graduate program in our Nursing Management Executive Leadership track. Or a clinical faculty member, that's a person who is a nurse at Dartmouth-Hitchcock, for example, and they work with 4 to 6 or our undergraduate students in our medical surgical clinical rotation there. And so they're such a hugely important part of our faculty. And like I said, they are amazing people that do great work with us. And then I just wanted to get a sense of what on Colby-Sawyer campus, some of the spaces that we've expanded to as the programs grow. We know that we needed more lab space and more space for clinical practicing. So I'm sitting here in Colgate Hall, where our School of Nursing and Health Sciences kind of faculty and staff are. And we have a beautiful nursing lab here in Colgate that students learn assessment skills, how to take blood pressure, how to do an evaluation. Then over in Mercer Hall, we have a couple different labs. We have another nursing lab there, which has really been dedicated more to simulation. And simulation is a growing area of healthcare education where students get to practice on mannequins and in simulation experiences what they would actually see in the clinical environment. So it's a great environment for them to learn and make mistakes. And we have a lab kind of dedicated for nursing students to have those simulation experiences. We also have an athletic training lab here at the college in Mercer, where students also learn athletic training skills. And we have a human performance and exercise science lab where students do things like VO2 max testing and other performance-related skills that exercise science students would need to know. And lastly, we still partner with Dartmouth-Hitchcock Health pretty closely and utilize. They have something called their Patient Training Safety Center. So this is a beautiful facility up at DHMC where it's a simulation center where nurses, physicians, other healthcare providers can go and once again learn and simulate what they might experience on a floor with the patient. So not only do students practice, but also healthcare professionals for continuing education need to also practice these environments. And so our students often learn in that patient training safety center with physician assistant students from Franklin Pierce and Geisel School of Medicine, medical students and Colby-Sawyer nursing students are working together through interprofessional education and how to work on a healthcare team. So it's a really dynamic environment that our students get to experience up at DHMC. So a little bit about enrollment. So in our undergrad program, what you can see here is that on the bottom, those are our undergraduate programs that I shared with you earlier. And what you're looking at is the enrollment that was happening in spring of 2020 and where it's moving to in fall of 2020. So our biggest growth area is our undergraduate nursing program. So this year, we had 180 students in our nursing program in the spring. We brought in 98 first-year students, graduated some students, and so we're up to 237 undergraduate students in our nursing program, which is a big jump for us. And then right across the board in exercise science, public health, athletic training, and health science, you can see where those programs are. A point of noting is our athletic training program is, we made a decision as a college about a year ago. The profession of athletic training made the decision that it was going to go to a master's level to practice athletic training. And so college universities had the choice whether they wanted to elevate their bachelor's degree to a master's degree, or some programs made the choice that it didn't make kind of sense for them to do that. So Colby-Sawyer decided that we're going to teach out our Bachelor of Science in Athletic Training over the next 3 years. So those numbers you will see will continue to go down as we graduate classes. And then the last bars there talk about the total undergraduate enrollment in the School of Nursing and Health Sciences. And what we're predicting is as our nursing numbers grow, we're going to see continued growth in our undergraduate numbers for our School of Nursing and Health Sciences. And this slide here shows you kind of what I call the professional learners. So it takes into account our RN to BS students, our RT to BS students, the associate in health science, and our MSN students. And so what you're seeing there is there's continued growth in those programs as well. And so if you combine those all up and you look at the last set of bars, we went from 320 students in the School of Nursing and Health Sciences to 432. So what that shows is that all the programs that we've been bringing on and the continued growth in undergraduate nursing is seeing some great enrollment numbers in the school, which is really exciting to be part of. So I wanted to put this slide in for folks to show you really what enrollment looked like this particular past year. So our associate's degree in health science has 20 students enrolled in it, and that's a great number, and it's going to continue to grow. For our nursing students, what you can see here is that nursing freshmen that we brought in this fall, we brought in 98 first-year nursing students, and our goal was 80. So we really did a great job in the college in lots of departments, from admissions and marketing and across the campus, did a great job at recruiting a really great first-year class of undergraduate nursing students. And then you can see we've got 58 sophomores, 35 juniors, and 41 seniors right now that are going to be graduating Colby-Sawyer in the next 6 months. And then our RN to BS, we have 40 students in that program. An MRSN program has 25, and our respiratory therapy program has 6 students. So this just gives you a snapshot of some of the work that we've been doing, and the enrollment in those programs has been really strong for us, which is exciting. And this slide is really showing you, I talked a little bit earlier about with our enhanced partnership with Dartmouth-Hitchcock, we have some benchmarks that we will be looking to achieve each year for our nursing enrollment. So for example, in 2020, our baseline was to bring in 80 students. we brought in 98. And then next year, we're going to increase that number by 15. So our baseline for 2021 would be to bring in 95 first-year nursing students. And then 2022, it would go up by 15 again to 110, and so on. And then on the graduate side, meaning how many students we're going to graduate from our program, the target by 2023 is to graduate 45 nursing students from our program, then to graduate 50, and then to kind of graduate 65. So you're seeing, as we bring in more students into nursing, we want to graduate more nurses, which is really the goal of the partnership, is to increase the workforce, particularly in nursing, where there's such a shortage right now. So, and that is sort of the targets that we're looking to achieve over the next 5 years. So what I wanted to show here is really, with Colby-Sawyer College and Dartmouth-Hitchcock Health, this enhanced partnership is not only just has been about recruiting students and creating programs, but a lot of other work has gone in, which has been really amazing. And what we've done since I arrived in February is we really worked hard to make sure that Dartmouth-Hitchcock and Colby-Sawyer are working together. So, for example, we have partnered with Dartmouth-Hitchcock's marketing department and Colby-Sawyer's communications and marketing department, and there's synergy and intersection between marketing efforts. So we meet weekly. We talk about the needs of Colby-Sawyer and the needs of Dartmouth-Hitchcock Health, and what kind of programming and collateral can we create together. For example, up at Dartmouth-Hitchcock in Lebanon, there's a lot of monitors throughout the medical center that are kind of employee facing. And so we work with DH to be sure that all of our programs are on those monitors so employees can see the opportunities at Colby-Sawyer. Another example is we've worked closely with the workforce development team at Dartmouth-Hitchcock Health. And for example, right now, we're working with them to do some programming, particularly to our seniors who are going to be graduating in May, around all of the opportunities that Dartmouth-Hitchcock Health affords somebody graduating Colby-Sawyer with a nursing degree, and what they can do, the opportunities for, working in different departments. And so that's been a really nice piece of how we've been able to partner and market and communicate our programs both across Colby-Sawyer as well as Dartmouth-Hitchcock Health. A second piece has been student engagement, and I think if I flip ahead here, we've really worked with the workforce development team at Dartmouth-Hitchcock to really think about how can we, obviously nursing students are a focus of the partnership, but broadly, Dartmouth-Hitchcock Health is looking for employees. And so they're looking for students who graduate Colby-Sawyer with a business degree or a marketing degree or a graphic design degree to be able to have Dartmouth-Hitchcock as a place of employment for them. So what we started doing was thinking about how can we engage Colby-Sawyer students at their freshman year to learn about the career opportunities at Dartmouth-Hitchcock Health and healthcare overall. I think what we've seen is sometimes students think working in a healthcare system is only for those who are clinicians, but there's all sorts of opportunities for careers in healthcare. And so, for example, this year last week we did a panel, a career panel of Dartmouth-Hitchcock employees. So these are folks in some of the clinical professions like physician assistant, but a lot of them were from the marketing department. One of the individuals worked in their laboratory area, and they basically came into one of our first year experience courses for our first year students here at Colby-Sawyer, and talked about all the careers and what they how they got into their career at Dartmouth-Hitchcock Health. And the idea of it was to spark an interest and just build awareness that healthcare doesn't mean you only can be for nurses and physicians. You can work in healthcare in lots of areas, from IT to human resources. So, and then from there, we were really working on what other ways can we engage Colby-Sawyer students across the sophomore year, junior year, and senior year, or even our alumni, to talk through what are the opportunities at Dartmouth-Hitchcock Health. And so that's what I call what the student engagement piece that we've been doing here. And workforce development has been a major department at Dartmouth-Hitchcock Health that works closely with us here at Colby-Sawyer to talk about what are the workforce needs at Dartmouth-Hitchcock and how can Colby-Sawyer continue to help develop those from our students who are here to our graduates that will go on and work at hopefully Dartmouth-Hitchcock if they have an interest. So one example is we've started to develop more internships at Dartmouth-Hitchcock Health for students across our programs. So we've got students and interns now in their marketing department, in some of their finance departments. So Colby-Sawyer students can do internships around the Dartmouth-Hitchcock Health system, and just be exposed and aware that that is a career for them. And the last thing we've been doing is thinking through how can we continue to partner around career development and professional development. So one example that we've done recently is I talked about the simulation labs that exist here at Colby-Sawyer. We've been working with Dartmouth-Hitchcock folks who work in their simulation lab to come down and do some kind of cross training of our faculty, so our faculty become more experts in simulation. And the hope is that Colby-Sawyer's simulation lab will be a place that that Dartmouth-Hitchcock can actually bring healthcare professionals, so nurses or physicians or EMTs, folks that need simulation. They don't have to go all the way up to Dartmouth-Hitchcock in Lebanon. They can come to Colby-Sawyer and we can do simulation and professional development and career development here on campus. So conversations like that have all sparked as a result of this great kind of enhanced partnership between Colby-Sawyer and Dartmouth-Hitchcock Health. I talked through that one. And then the last kind of slide I want to share with everyone is kind of where do we think the opportunities are next. And so we've done a lot of great work in developing new programs, and we're starting to launch those, and students are starting to enroll in them. But we're also thinking about the future. What other opportunities? So I'll talk through a few. We have two programs that we're going to be rolling out this fall. One is an accelerated Bachelor of Science in Nursing, and that is for folks who already have a bachelor's degree in a non-nursing major. So somebody maybe had a BS in psychology or a BS in business administration. They might be working in that career, and now they say, you know what, I actually want to become a nurse. So we have an accelerated BS nursing program that we're launching this fall in 2021 that will be an opportunity for those learners to come back to Colby-Sawyer and basically in 16 months get their BS in nursing. Since they have their BS, they have a bachelor's degree already, they only have to take the nursing courses. So that's why it's the accelerated program. And the second program we're launching in fall of 2021 is an online Bachelor of Science in Health Science. And so that's really geared towards those folks who are in that associate's degree program for them to continue. What we've noticed, those that have started, the 20 that are enrolled with us already, they don't want to be done. They want to keep going. So this idea of an online BS in Health Science came out of that interest from that student population. So we're really excited to partner with Dartmouth-Hitchcock Health and the associate's degree students to enroll in an online BS in Health Science degree. And then some other programs that we're considering down below. There's not a timeline with those, but we're looking at what other areas in nursing and maybe in the master's world of a nurse practitioner, a family nurse practitioner program at Colby-Sawyer, maybe a doctor of nursing practice program. In the exercise science space, we're thinking about maybe a Master of Science in Strength and Conditioning or Exercise Science in those areas. We've been in some conversations with doctor of physical therapy programs in the area, such as UNH and Plymouth State, to do kind of a bridge program where students could come to Colby-Sawyer for 3 years and then move to a doctorate program at another institution. So we call it 3+3. Or maybe eventually, if we think is feasible, to develop our own doctor of physical therapy program. So those are some of the things that we're also exploring for future programming here at Colby-Sawyer. Kind of ran through those, but I think, Tracy, is this the time we wanted to
Yeah, thanks so much, Kevin. A lot of great information there, and we've had a number of questions come through. So we're going to get right into those so we can try to get through as many as possible. Really great to have a question from one of our 1987 nursing grad. She says she's really excited to hear about the growth in our healthcare programs, and she's wondering if faculty recruitment has been a challenge.
Great question. So in particular in nursing, so since I've been here at Colby-Sawyer, we've launched 1, 2, 3 national searches for faculty in nursing, and nursing searches throughout the country are challenging, and that's something that's not uncommon to Colby-Sawyer, and that's often a result of in clinical practice, folks can have a career and it's a financially rewarding career. And so for sometimes to make the switch to academia, the financial side for them sometimes doesn't equate. So there's a national shortage of nursing educators throughout the country. So I think in Colby-Sawyer, we've been fortunate. We've had 2 positive searches so far. We're in the midst of finalizing a 3rd search right now where we have a candidate. So I think we look for a particular faculty. I think we look for folks who are, who've been practicing clinically, then want to make a transition into education. And that's been the folks that we've really been able to attract here. So we've been successful thus far, but it is a challenge. You have to make sure you're promoting and marketing the faculty positions in the right outlets. So I hope that answers the question.
Great. Well, certainly during these times, we've had a number of questions come in that pertain to the COVID-19 pandemic. And so one question is, to what extent are you hearing from prospective students that COVID-19 is a factor in their desire to go into healthcare?
Yeah, it's a great question. We've certainly heard, so the first year students that have been here on campus, I've heard from some of them that I think the pandemic has certainly raised awareness of healthcare. And I think there's been some folks that have sparked an interest as a result of the pandemic. And so that's been information that we've heard here talking with our students and our first year students, particularly because those are the ones that were recruited during the pandemic time. So that definitely comes out. And then there's other students that nursing or health sciences was something that they were passionate about, for a number of years. And so, but yeah, we certainly have heard, since healthcare and public health, for example, are at the forefront of what a lot of the news and the media that we're seeing, it certainly, I think, has raised awareness for students and sparked interest in maybe careers in healthcare or public health they may not have had before.
And another question related to COVID-19, and particularly, in particular for our nursing students, how are you providing a quality clinical experience for your nursing students while ensuring their safety during COVID?
That's a great question. So we're hearing as numbers rise and cases rise in the region and nationally, what we're seeing is other nursing programs are actually not doing clinicals in person. And they move to a lot of virtual clinical experiences, which we know that is not the best environment for our students to be in. But oftentimes those decisions are made by the healthcare organization. So a hospital will say, we're not going to have students here because we're not equipped for it. So fortunately for us, working with Dartmouth Hitchcock Health and DHMC in particular, that's where our nursing students are doing their clinicals. They've continued to go. So we have 1 more week of class and they've been going since September. So that's been great for them. So part of the things we do to kind of protect our students is obviously Dartmouth Hitchcock Health has a lot of policies around, appropriate PPE wear. And so all of our students obviously abide by those protocols and those policies. Our students during their clinical rotations are not on COVID floors, so they're not taking care of COVID patients. So Dartmouth Hitchcock up in Lebanon might have COVID patients, but our students are getting experiences in other areas of the medical center. So that's something that that they're not exposed to patients. And there's a whole set of screening processes. Every time you enter the medical center, you have to have your a temperature checked. You have to, there's a series of questions. So where our students are following those to be sure that they're safe.
Great. Another theme that we've been talking a lot around the country, of course, is equity, diversity, and inclusion. And so we have
Sure.
someone in the audience asking how we are teaching racial appreciation and respect in an area like New London that is primarily Caucasian.
Yeah, it's a great question. So I think one of the ways that we do this in our curriculum is to weave in those different concepts into our courses. And so we want to make sure when we're teaching courses around kind of say health assessment that students understand that folks might have different beliefs and rituals, and how people might not be super comfortable with you putting your hands right on them. So our faculty work really well with our students around understanding cultural competency and weaving that in kind of consistently throughout our curriculum, so students get an appreciation for all folks from all different areas. Another way is obviously during our clinical experiences. I think when I think about our students seeing patients at Dartmouth Hitchcock Medical Center, diversity is across the spectrum. So they're seeing folks from different socioeconomic status, from rural areas. So their exposures, I think, are getting a diverse set of patient experiences through their work at Dartmouth Hitchcock in their clinical rotations. And then we work hard in our curriculum to be sure that we weave those concepts into our courses here here at the college.
Great. So we have a couple of questions that pertain to our relationships here in town or the surrounding area. And so we have a retired doctor who had a great career at New London Hospital, and he's wondering what our vision is for a relationship with New London Hospital. Sure.
So traditionally, seniors during their nursing capstone work with community agencies in New London. Due to COVID this year, that's been a bit challenging, but our nursing students have worked with some of the partners in the area. One other example is our students do a rotation at New London Hospital in their emergency department, in their operating room. So they get to kind of see the local at New London, our local community, and our those that live in the community. So through clinical rotations at New London, as well as one of our courses is a community health course, where our nursing students right now are working with the Lake Sunapee VNA on a community-based project around kind of hospice care. So we do try to work with our New London partners, not only New London Hospital, but other community organizations, so our students can go out and experience the New London community in different ways.
Great, and that's the same person mentioned our great relationship with the Lake Sunapee region VNA and hospice. Yep. And the internships available there. But another kind of follow-up question is, somebody said, do we have more plans for our students to do community health nursing in the town or other surrounding areas?
Yeah, that's actually a great timely question. We just had a call. So myself and Joan Loftus, who is our director and chair of nursing, met with Carolyn Isabel, who's the director of workforce development at Dartmouth Hitchcock, and one of our local communities around kind of hospice care. And basically the crux of the conversation was how do we expose our nursing students to more of home health and the opportunities to work in nursing in that area. Much of it's spent in med surg and in some of those rotations. And one of the ways that came out of that conversation is, wouldn't it be great if we put a panel together of kind of just areas that you can work in nursing that are outside the usual areas that our students are in. So like I said, community nursing, hospice care. So our students can know that nursing is such a broad area. You can work in lots of different disciplines. So this spring, we're going to get together a panel of nursing folks and come into our classes. It might be in person or virtual, but to kind of talk more about those other areas of healthcare and working with our community partners to bring in nurses and other healthcare providers so they can hear and learn, students can hear and learn about those opportunities that are in more of our community organizations, our community healthcare facilities.
Great. So we have another nursing grad online, and she is curious about the pass rate for our seniors for the NCLEX boards.
Sure. It's a great thing to talk about. I love talking about our pass rate. So on our website, we have an outcomes tab that kind of goes through this in the past 5 years. And don't quote me here, but this year was this past in May of 2020, it was a 97% first time pass rate. In 2019, it was 98%. Prior to that, the 2 years prior to that, it was 100%. So we've really been doing, our faculty and our students have been doing an outstanding job in our NCLEX preparation. And I know that faculty and students spend hours preparing for our NCLEX, and it's something that really talks to the quality of our program. And so we're well above in the state of New Hampshire, we're kind of over the past 5 years, we've had a great NCLEX first time pass rate and oftentimes top in the state. So that's sort of a kind of over the past 5 years, that's where we've been.
Super. So another question here, a little more on the marketing side of things. This was submitted beforehand. And the questioner writes, because of the Dartmouth-Hitchcock partnership built upon the already advanced Colby-Sawyer platform, where do you think your strongest innovations will come from? And over time, do you expect to attract a top nursing candidate?
Yes, I mean, one of our goals when I came here is really was building upon something that was already quality. Our undergraduate nursing program at Colby-Sawyer has been historically strong for 40 years, and so now we want to take it to the next level and be really a premier school of nursing and health sciences. Not only nursing, but our exercise science program, public health program, to be a top premier school of nursing and health sciences in the New England area. And so what we've been doing in the marketing space is really part of the work that we've done is we partner with a consulting firm to really broaden Colby-Sawyer's reach. I think telling folks outside of a 60 to 90 mile radius the great things that our students are doing and what their careers are going. So going throughout New England and sharing that through kind of social media and making sure people know about the great work that's happening here. And so there's been a lot of marketing and communication work in the past year that have really gone into, spreading the word on Colby-Sawyer and getting a brand awareness out there about the great work that we're doing, not only in nursing and health sciences, but across Colby-Sawyer's campus. So yeah, I think one of the areas we need to grow in is our on-campus facilities. I think to be a premier program, when you look at nursing and health sciences schools that are around us, they've got some really innovative technology and on-campus facilities that really attract those top nursing and health sciences students. So we got a solid faculty. Our faculty are dedicated. We've got great clinical partnerships with Dartmouth-Hitchcock Health. I think the next area that we need to grow in is really increasing our on-campus facilities that I think are top notch. That's how we're going to really start to recruit a top quality nursing candidate and health sciences student.
Another question here. Can you speak to any curriculum areas you may have identified where changes could increase undergrad nursing retention? For example, moving microbiology from first year to second year and or spreading microbiology over 2 semesters instead of just 1.
Yeah, it's a great question. And I think when I got here, that was something that I think a lot of the faculty, not only in the School of Nursing and Health Sciences, but also across the campus, brought to my attention around, the science courses for our students when they come in are challenging. And that's not unique to Colby-Sawyer. In my other experiences, we call them gateway, those first gateway science courses, microbiology, anatomy, and physiology. What we've seen is the course itself doesn't necessarily matter. So that first course they take here at Colby-Sawyer is microbiology, but years ago was a different biology course. Sometimes it's chemistry, sometimes it's the students adjusting to college, and the expectation seems to be where the challenges are facing our students. So one of the things we did this fall is for our first year nursing students, we implemented a nursing seminar course, a 0 credit course that was really geared towards building up their study skills, building up their ways that they can be successful in their science courses. And so that's taught by Ariana Anton, who's a faculty member here in the school, but it's in collaboration with our we call our SLC, our learning collaborative. Those are folks who kind of work with students around this support. So it's been really nice to see our faculty member who knows nursing, but also experts that know kind of the things that our students struggle with. And they're teaching this seminar course to our first year nursing students to help them with study skills in planning and kind of how to read a textbook properly. You know, all these things that we certainly take for granted. So we're really excited to see how that particular course helps students perform in their first year.
This, as you talk about the demand of some of these majors, nursing in particular, we have a question wondering if these student schedules allow for them to participate in extracurricular activities.
Yeah, it's a great question. So nursing in particular, but a lot of health sciences programs, there's a high academic rigor, not only in the academic courses, but also the clinical components. So their schedules are certainly tight, but at the same time, we have a lot of student athletes, for example, that are nursing majors. And if you talk to our faculty, some of them are our best students because that idea of kind of scheduled, activity and academics, it really helps them thrive. So yeah, within our program, we have students who are not only student athletes, but they are part of clubs and organizations at the college. So yes, it is an academically rigorous major, but it doesn't exclude them from participating in things outside of the classroom. It takes a really talented and mindful time management student to be able to balance all of that, but we've had students do that very successfully.
Kevin, I think you may have touched upon this during the presentation, but I want to make sure this person gets an answer to their question. They're wondering about the programs that are offered for Dartmouth-Hitchcock employees. Are those courses held here on our campus in New London or at the hospital?
Sure. So when I showed this slide, for example, here that looked at, our respiratory therapy program or any of our master's programs or RN to BS program, those are all, we made the switch this year to all of those courses are online, and they're in 8-week sessions. So we really try to build a program for the working professional learner. So if you're a registered nurse and you're trying to come back and complete your BS degree, our program is really created in a way that allows you to have online courses in 8-week sessions, so you can do it around your busy working schedule. And they're taught by our faculty who have done a great job at creating an online course that allows students to progress through it. So yes, they're all of our courses are online, and they're not kind of on campus here at Colby-Sawyer.
Terrific. Well, we're running out of time. I just wanted to share, Kevin, that you're getting lots of kudos. Folks are really excited about these new offerings and understanding the need for healthcare professionals, and the fact that Colby-Sawyer, they're really proud of the fact that Colby-Sawyer is, we're doing our part to meet those needs. And so a lot of excitement and well wishes coming through here on the chat.
Great. It's been great. It's really one of the things I'd like to say is coming here. It's been such a welcoming environment and a community that's welcomed me in and my family in, and it's been a really great transition. And I think I hear the same thing from alumni. For example, we always try to talk with alumni to hear what they think we could do differently, or what we're doing. We did a good job at, and the alums are always great. They're always willing to sit down and talk with us and share their experiences. So it's been really great for me as the dean to kind of talk with students and alumni to understand what they're doing, and they have great things to say about Colby-Sawyer as well. So
great. That about wraps up our time for this evening. Just as a reminder, we have recorded this session, and we'll be sending that to all of you if you want to go back and just recap. In the meantime, if you have other questions that come up, feel free to email us in the alumni office, alumni@colby-sawyer.edu, and we will get those to Kevin, and we can get some responses to you for any further questions. Thanks, Kevin, so much for leading this conversation. This is a really exciting time for the college, and I know we have a lot of folks rooting for us, and we'll be, I know all of these folks will be anxious to follow the growth and success of these programs, and we'll be sure to keep everyone informed.
Thank you, Tracy.
To all of you in the audience, thanks so much for taking time out of your evening to join us and learn a little bit more about what's happening in the School of Nursing and Health Sciences. Be sure to watch your emails for further announcements about events and webinars just like this one. And with that, we're going to say good evening, and we wish you all a very happy Thanksgiving. Take care, everyone.